Hello, everyone, and welcome again to our monthly staff town hall. My name is Hallie Nicholson. I work at Human Resources as the HR Strategic Communication and Engagement Manager, and I'm so happy to be here with you today as your moderator. So before we jump in, as usual, I just wanted to cover a couple of housekeeping things and make sure we're all on the same page. We've got a great group of panelists here today to answer your questions. Many of you submitted questions with your registration, and we've gone through those to try to pick out the hot topics that are coming up. We also want to encourage you to submit your questions using the Q&A window on your screen, and we'll have folks both looking at those questions potentially to answer live on camera and also to answer via text in the Q&A as well by some of our behind-the-scenes panelists. So be sure to submit your questions. Due to time limitations, we likely will not be able to get through all our questions, but what we are doing is logging them and finding what those top questions are and adding them to the Return to Learn website, which you'll find a link to in the chat. We also have live closed captioning available today for those who would like to use it. You can access it in two ways. One, you can click the closed caption button at the bottom of your screen and select show titles. And you can also click the link that will be popping up here in the chat just a minute if you would like to access live captions. So with that, I would now like to introduce my colleague, Nancy Resnick, our Chief Human Resources Officer, to kick us off.
Thank you so much, Hallie, and welcome everyone. Before we get started, I want to pause for a moment and acknowledge that right now, many of us are watching and listening very closely to very critical events that are unfolding on the national stage related to the Derek Chauvin verdict, which is expected and may be rendered during the time that this staff town hall is going forward. This is tremendously important and impactful for many of us in our community. And we want to allow folks to have the space to pause and recognize that due to being engaged with this deeply impactful process, it may be difficult for some who have joined us on the staff town hall to really focus on the information that we're wanting to share during this staff town hall. So for that reason, I wanted to share a couple of things. One is that we will ensure that this information is made available to you. So if you are not able to participate at this time, well, you have our full support and understanding for that. We will ensure that you are fully updated. I also wanted to share that through Dr. Crystal Green's leadership of FSAP, the Faculty and Staff Assistance Program, we will be holding a healing space tomorrow for staff and faculty for those who wish to gather in community and help support and process the verdict and the significance of all that is happening. We will have information more specifically about the timing and the way to access and connect with that space. And we are also actively looking, the institution and institutional leaders are looking to support our students as well. So I want to just acknowledge how deeply important this is, and that we are here in support of you all and understanding that. Having said that, we do have a great deal of very important information to share with all of you as part of the staff town hall. So please know that we are just wanting to afford flexibility and recognition in terms of what's happening kind of outside on the national stage. And at the same time, we do have a great deal of information in the staff town hall today. So with that, let me just say a couple of things. I appreciate you coming to join us. As always, we have over 1,000 participants right now in my Zoom call. And I know that we had well over 1,300 colleagues register for this event. So it is great to have this opportunity to connect virtually and to share important updates with all of you. Thank you for coming. I'm really pleased that earlier this week on Monday, I was able to share some important updates that relate to our return to campus plans. And those, of course, reflect the direction and decisions of our chancellor. Please take a look at the notice if you haven't yet had a chance to see it. And we're putting a link in the chat as well for ease of reference to that information. But a couple things I do want to highlight in that regard. I know and I deeply understand and appreciate that for staff, especially for those of us who moved into remote work, 13 months ago at the start of the pandemic, there are many, many, many questions that are about what is return to campus and the reimagined workplace going to look like. We know a few things that I want to emphasize. We know that our return to campus starting June 1st will be gradual, thoughtful, and strategic. We know that it will be based on innovation, equity, and flexibility. And we also want those principles, particularly around equity and flexibility, to apply to all staff, including those who have continued to work in person during the pandemic, as well as those who moved to remote work. I have just received a text saying that the verdict is being read now. So what I'm going to offer is that we just take a pause for a few minutes. We will resume, it's 2:06. We will resume at 10 minutes after, and we will just be here with you and allow for the pause for the verdict to be read, and we will be back. Thank you. I believe we're back. Can someone confirm with me that we are back?
Yes, we are, Nancy.
Thank you very much. Thank you very much. And I appreciate everyone taking that pause with us. That's very much appreciated. Thank you. Let me return to talking about our return to campus and reimagining the workplace. Between now and June 1st, our staff will continue in their current work arrangements as they have during the pandemic. Between June 1st and September 1st, our return to campus will be implemented based on operational needs and looking very thoughtfully and intentionally considering the lessons learned from the pandemic that relate to workplace flexibility and technology. We've determined that operational needs allowing, managers will do their best to provide at least 30 days advance notice of changes to current work arrangements. We recognize how important it is for everyone to have advance notice and time just for planning and making personal arrangements related to the numerous aspects of life, including caregiving and other responsibilities that we all have. Separately, I want to acknowledge in each of our past staff town halls, we have talked about the impacts staff have experienced related to mental health and well-being during this past year. May is Mental Health Awareness Month. And it's a great opportunity to highlight the importance of creating a culture of dialogue around mental health issues. We've been intentional in incorporating mental health and well-being topics, including resilience and grief, into our monthly staff town halls. And we share regular reminders about mental health resources for our staff and faculty through our Faculty and Staff Assistance Program, FSAP, which is part of Human Resources. As always, I would encourage you to take advantage of these wonderful resources and to make mental health and well-being a priority for yourself. We've got a lot of information to share with you today. We have updates on the vaccine, more information related to return to campus and reimagining the workplace, and information about cybersecurity updates. So with all that, let's get started. Back to you, Hallie.
All right, thank you very much, Nancy. And as Nancy mentioned earlier, I just want to remind everybody that these events are recorded. So if you are finding yourself needing to step away or take a minute today, you'll find the recording of this event and all the information we shared on the Return to Learn website in the coming week or so. So let's get started with our updates today. And first, I'd like to welcome our regular panelist, Dr. Angela Sosha, Interim Director of Student Health and Wellbeing. And Angela is going to give us an update on the state of the pandemic. So take it away, Angela.
Thanks, and good afternoon, everyone. So here's where we're at. Some very good news, but also some words of caution. We've got sort of the global, the US, California, and San Diego numbers for total cases. They are really pretty amazing numbers, as well as the number of deaths. And sadly, the deaths continue to occur. They occur in San Diego, California, the US, and around the world. So we are not through this pandemic, but we are making progress. If you look on the graph, you'll see in sort of the dark orange that we peaked with the number of daily cases just under 250,000 after the winter break. You were seeing numbers, 250,000 individual new cases every single day. We made some very good progress, and in March, that number had slid down, and we were just around 53,000. Unfortunately, it's been creeping up slowly, and we need to keep an eye on this. It was, the day I pulled this, which was on Sunday, it was not quite 72,000 individuals on a daily basis. The green line is an important one, though. You can see how dramatically a country, and this is India, went from a relatively stable situation to an unbelievable dramatic rise. And this just speaks to this virus and how when it takes hold in a community, it can exponentially spiral out of control and very rapidly. And we've seen some of our students who've returned from India, the impact of this virus. Next slide. There you go. So in the US, and this just looks at our different states, you can see California highlighted in the blue. And you see that we're actually pretty good. It looks like we came down, it looks stable, but there's a little bit of a tail that's starting. And this is what you're watching very carefully to see, does this kind of just stay at this level, or do we start to see a rise? There in orange is Michigan, and you can see this is what's contributing significantly to the U.S. dramatic surge in cases. So California right now is looking with a little bit of an uptick, which we're watching very carefully. Next slide. Here's a little bit of the San Diego County. We are in orange here. We actually had the cutoff of 6.0 per 100,000, which would be in the red tier, but it was only for 1 week so far. We'll have to see what this week's numbers are like. 2 weeks ago, it was 4.8, then it was 5.9, now it's 6.0. So you can see this subtle rise in activity of the virus. So we need to watch this very carefully. But the other indicators are very good. The absolute number of community outbreaks, this number was dramatically higher a few months ago. The ICU capacity is excellent. You see a stability. Hospital census is over on the right. It's been relatively stable. So by and large, the picture in San Diego County is very good. And Chris will share some of the good vaccination rates. So we're doing pretty well, but we do need to watch this very carefully. Next slide. And part of the reason we have to watch it is because over half the cases in San Diego now are the UK variant, the B1.17. This is half of our cases. This virus is, the mutation allows it to replicate more effectively, higher viral loads of the individuals that are infected, and it's more easily transmitted. Right now, our therapies work well for it. The vaccination works well for it, but it is more transmissible. So you will get more cases for every infected individual with this variant. We also are seeing a little bit of the Brazilian variant as well as the South African variant, but nowhere near the impact of the British variant. Next slide. So what are some new updates here we have on our local situation? Reminding everyone, you saw in the preview on the slides, that we have expanded our locations. We have plenty of locations for you to get testing. Every one of the machines is working well. We do have a change though. You need your campus ID card. You need to swipe to access a vending kit. So make sure you have a valid campus ID card with you when you need to pick up your kit. You also see it's $1 on and $1 off. That is an administrative function. The vending machine for the swipe card function, we had to charge something, but it is immediately reversed that night. So you will not have anything to pay. Testing remains free. At the Price Center, we have the one location on campus, which there's provider administered testing. Remember that is by appointment only. On Tuesday and Wednesday, we have extended hours, which allows staff who have late shifts or early morning shifts to be able to go over there for some testing as well. And they are open on Saturday and Sunday. We have made a change in policy, fully vaccinated individuals, which means you have completed your series. If it's the Moderna or the Pfizer, that's a 2-dose series. Right now, the single dose J&J is on hold, so we're basically back to 2-dose series. But after you have completed your final dose and 2 weeks have passed, and this is really important, you need another 2 weeks before you reap the full immunity benefits of the vaccination. Then you're considered fully vaccinated and you have the protection of the vaccine. We've made the decision, and the science supports it, that individuals who are fully vaccinated no longer need to do asymptomatic testing every week if you're coming on campus or you live on campus. You only test now for symptoms if you're a fully vaccinated individual. And please continue to do your daily symptom screener. The other change is we are allowing staff to have meetings indoors, but you must be masked the entire time, and you have to maintain distance and no more than 10 individuals at a staff meeting. So you have to be in a room that is big enough to accommodate individuals with the 6 feet of distance. It's really important that even though you're fully vaccinated, you continue to mask. We all need to mask outside of our homes because of the chance of potential picking up a little bit of virus or shedding a little bit of virus, even though you won't become infected. And we think most vaccinated people are not infectious as well. But we are very much recommending strongly in campus policies is to continue to mask outside of your home. Next slide. Here, how are we doing on campus? We're doing really well. Now, on the left, you see the county rate, the percent of tests which are positive. It's just under 2%. That is better than it was. Remember, it was almost up to 4% a while ago. For our employees, it's 0.02%. Really, we are seeing very few campus employee tests that are positive. We think this reflects that folks are following the preventative measures, as well as many of our employees are now fully vaccinated, which is wonderful. If you've not received your vaccine, please get vaccinated. And Chris will be sharing more information on vaccination. So listen for that section. Our students are a little bit higher at 0.13. They're still doing pretty well overall, but you will see that that is a little uptick from where we were a few weeks ago. On the right, we actually look at the case rate per 100,000. So that's in the entire population. The left is of the tests that are done. This is actually case rate based on the population. And the red diamonds are the San Diego County 20 to 29-year-olds. The red liners are off-campus students, and the yellow is our on-campus. So we've had a little bit of an uptick, nothing too bad, still a relatively low rate, and certainly less than their peers. The very nice line of the campus employees is the green next door. So we've had many days with no campus employees testing positive. Next slide. And this is just to remind you, you can get a lot of information on the dashboard, the RTL dashboard. Every day we're updating this. We're doing between 1,000 and 1,500 tests every single day for our students. The students that are living on campus are in the dark blue. Off campus are in the lighter blue. And you'll see every day we may not have any students, or we may have 1, 2, and occasionally we have 3 students that are positive. But the numbers are relatively small, and we're very pleased with that. On the right, you'll see the campus employees doing a great job, still continuing to test, because we just made the change to drop the fully vaccinated testing requirement. So that testing up until now has been recommended for everybody. And you'll see that very few campus employees are testing positive. So again, if you've not completed your vaccination series, you're not fully vaccinated, please do, you're coming onto campus, please continue to do weekly testing. It's really important that you continue with that. If you've been fully vaccinated, you don't need to do the weekly test, but if you develop any symptoms, for sure, we want you to get tested. Okay, next slide. And I think I'm going to hand it over to Hallie, back to you.
Thank you very much, Angela. So our next presenter, as Angela was about to mention, is another colleague, medical colleague. So I'd like to welcome Dr. Chris Longhurst, Chief Information Officer and Associate Chief Medical Officer for UC San Diego Health. And Chris is going to talk to us about vaccines. So take it away, Chris.
Thank you very much, Hallie. So I wanted to give a little bit of the national picture. If you hadn't heard, we crossed a really important threshold this week, with over 50% of the population over 18 now having received at least 1 dose of vaccine, and 25% of the population over 18 now fully vaccinated. So a lot to celebrate, since we really just started distributing vaccines four short months ago here at UC San Diego Health to our healthcare workers, as well as across the country. So on the next slide, we see a little bit of our state picture. And in the state, we see that about 32% of individuals are now fully vaccinated over 18. So doing a little bit better than the national average. And in fact, I think we're ranking in the top 10 now for vaccine rollout. And when you look at the county situation over on the right-hand side, you can see that San Diego County has administered over 2.3 million doses of vaccine, putting us second in the state. I think we're actually in the top 2 for per capita vaccination as well. So on the next slide, we'll drill a little further into San Diego County. You can see that the local San Diego County public health goal is to vaccinate 75% of San Diego County residents who are age 16 or older, which is a nice round number, close to 2 million. And so with 1.3 million doses administered, we now have 64% of San Diego County that's been vaccinated with at least 1 dose, and 40% that's considered fully vaccinated of that target population of 2 million. So great progress towards herd immunity. On the next slide, you'll see that across the University of California on the left-hand side, what's important to note is the vaccine availability really throttled some of our efforts for a few weeks. And you remember those closures at Petco and even Reimagining. but it's picking up again as vaccine availability has become greater. And we should all be proud as Tritons to look at that orange where UC San Diego is really leading the UCs in vaccine delivery. In fact, we're anticipating a milestone this week, which should be publicly celebrated, of 1 million vaccines delivered across the UC system. And you can see on the right-hand side that almost 400,000 of those have been administered here at UC San Diego Health. And we've helped to fully vaccinate over 150,000 individuals. So on the next slide, I want to talk for just a second about the Janssen. Everybody should be aware that that's on pause, our only single dose vaccine. But this is a vaccine very similar to the AstraZeneca vaccine that was approved in Europe, where they also saw similar issues related to women under 50 who developed a rare condition of thrombocytopenic cavernous sinus thrombosis. The details are less important than the fact that this is a clotting disorder that we don't see very often, and it seems to be elevated risk. And one of the questions that we hear commonly is, should I lose confidence in the vaccines? And the answer that Dr. Fauci gave is the same I would give, which is that this is an incredibly rare side effect, and it should actually be confidence-inducing that our post-approval vaccine safety process is catching this. And so we did exactly the right thing to pause. Our advisory committee on immunization practices at the CDC will be making some recommendations, we hope, later this week. In many countries in Europe, they've resumed AstraZeneca, but they're not administering it to women under a certain age. It's hard to predict what our own CDC committee would recommend, but that may be one potential outcome. Now, on the next slide, you can see update across UC San Diego. Now, these are only vaccines administered by UC San Diego Health to UC San Diego employees and students. So it's undercounting those employees and students who might have been vaccinated elsewhere. We're working on getting that additional data into our registries. But you can see just from the UC San Diego Health administered vaccines that over 10,000 students have now received at least one dose. Over 6,000 students are fully immunized. And for our health science and campus employees are 12 and 13,000. And you can see that the timing of those graphs reflects, when eligibility occurred as well. On the next slide, you'll see a really important topic to us at UC San Diego Health, where we're a safety net provider, and part of our mission is to serve the underserved communities. And so again, looking across UCs, UC San Diego is in the orange. And what this looks at is the California Healthy Places Index, which is a measure related to geographic disparities and COVID hotspots. And the important thing to understand is that towards the left-hand side is the more underserved community. Towards the right-hand side would be the more affluent communities. And so we've taken a really purposeful and intentional approach to trying to get vaccine out to these communities that have been particularly hard hit. And so on the final slide here, you'll see that we're really celebrating our mobile vaccine unit, which is partnered with local community benefits organizations. And we're often in a different spot every day, but delivering around 1,000 doses per mobile vaccine unit. Over the weekend, I think we had 3 of these out simultaneously, and we delivered as many vaccines in these communities as we're delivering at REMAC on a daily basis, which is really just tremendous and helping with that equity and addressing disparities. That's critically important if we're going to reach herd immunity as well as meet our mission goals. So that's it for me. I do want to make one final comment, which is that the question has come up about mixing with unvaccinated individuals if you're vaccinated or vice versa. And I really just want to reiterate that we know masking works. Here at UC San Diego Health, where we take care of patients who are COVID positive, we are not seeing spread from patients to providers because of masking. And so please continue masking until our county public health indicates that it's safe. As Dr. Socia suggested, we're happy to resume in-person meetings, but it's important to stay masked and not be eating indoors during those meetings so we can continue to contain the spread. So thank you very much, Hallie, for the time.
Thank you very much, Chris. It's exciting to hear. Makes me feel proud that UC San Diego has been such a leader in vaccines. So it's really great. And I appreciate you sharing that information. And especially the slide we're looking at right now is wonderful to see. So for our next guest or our next presenter, I'd like to welcome my colleague, Terry Winbush. She's our Senior Director of Labor Relations and Employee Relations, and she'll give us an update about return to campus. So Terry, take it away.
Thank you, Hallie, and thank you all for your patience with us today as we're all processing the verdict information that came out. Regardless of what you were looking for in the verdict, there is still impact to all of us in the community. So please show me some grace as I present this information to you. So we wanted to give you some more specific information about the return to campus to follow up on some of Nancy's remarks. Many of you saw the campus notice that went out. And so what you should know is that we are working very closely with each vice chancellor to identify priority areas for planning the phased return to campus. What you can expect is additional communications from your vice chancellors and other senior leaders within the next 4 to 6 weeks, giving you an update on the planning in your area and to do our level best to provide everyone at least 30 days notice for any changes to your potential work arrangement. And so this is not just for the employees who've been working remotely or who've been working in hybrid work arrangements where they've been partially remote or partially in person. This is also for those in-person employees who might be afforded some flexibility in their schedules as well. We're working through all of the various scenarios to really stick to our commitment to flexibility with our foundational principles in equity, safety, and innovation. Next slide, please. So along the lines of equity, safety, and innovation, some things that we wanted to make sure that you knew, that given our rich diversity, we will need to integrate considerations to address barriers and disparities that have impacted our employees for equitable outcomes. That's regarding the pandemic, but also separate and apart from the pandemic, things that we are working to address prior to the pandemic taking hold and things that we want to change as we move forward in embracing a much more rich and inclusive workplace. And we know that flexible work can enable a more inclusive workplace, and that is our goal. The other thing that we wanted to make sure that you all understood, the phased return is not about whether or not the campus is safe. The campus is safe, and the campus has been one of the safest places to be throughout this pandemic. Our phased approach is really so that we can be very thoughtful and intentional while we work with the vice chancellors, the supervisors, and the managers about what work really needs to be done when and where for each employee based on the role that they are performing for the organization. Other external factors that may determine the capability of many employees to return include things like the pandemic, but other external factors like people's childcare issues, elder care issues, and other things will come into play as we're looking through our phased return initially and as we continue. The entire point of the return to campus planning is to think about flexibility first in making sure that we meet our operational objectives. Next slide, please. Along the lines of that, we wanted to give you a preview of some of the trainings that we're going to be providing to managers and supervisors, but also to employees, so that we're all working from the same foundational principles as we think through our flexible first work environment in the future. So we will be providing a training starting next month and throughout the summer and going forward for building inclusive teams and trust. We will also be providing a training for managing remote and hybrid teams, because many supervisors have questions about how do I manage folks who are in person, who are remote, and who have a combination of those work streams. We'll also provide a training called Collaboration and Communication Tools for Teams in partnership with our partners in IT, because many people talk about, do I use OneDrive? Do I use Microsoft Teams? Do I use Google Drive? What do I do? And it's really about establishing some of those shared norms and understanding what options there are for everyone to work from. And then inclusive teams and trust for all staff. That's for our individual contributors and all staff to come to learn together on how to effectively engage and communicate with their colleagues in any environment, whether they're in person, whether they're remote, whether they have a hybrid work option, so that we can all work together for the betterment of the campus. And when we're all supported in our whole person selves, we all work harder and smarter. And that's the way that we want to continue as we move forward. So with that, I look forward to planning with all of your leaders and with some of you on figuring out the best work modality that's going to deliver the services that you need to deliver, as well as taking into account the whole person. And I look forward to answering your questions soon. So back to you, Hallie.
All right, thanks, Terry. Our next presenter I'd like to welcome is Vice Chancellor of Resource Management and Planning, Gary Matthews. And Gary's going to give us an update about some things relating to campus health and safety. So Gary, take it away.
Well, thank you. I'd certainly like to thank the healthcare providers for their vigilance and most importantly for keeping us all safe, and recently also their work in the underserved communities. I think it's extremely important. The Healthy Places Index certainly shows a good story. I think there are over 1,000 folks on this Zoom, and I suspect each of you know someone who may not have had the vaccine yet, and I urge you to encourage them to take it. I took mine weeks ago and have been very happy with it since then. Terry just stated that the campus has been safe and will continue to be safe, in part because of the vigilance that everyone has participated in. Certainly, Dr. Longhurst reminded us we should all wear our face coverings, our masks, remain socially distant. And as we start to open up the campus, I think it's important to remind you all that there are a host of activities that are happening behind the scenes that include the HVAC, heating, ventilation, air conditioned systems are operating at 100% outside fresh air. We've changed filters, we're cleaning and disinfecting things. And we recognize through the updates from CDC and research that transmission through aerosols is highly important to manage and watch. So the masks are important, as well as the building systems. Next slide, please. So part of what's also happened is that a number of things have changed across the campus, and we've tried to make the campus as accommodating as possible during the shutdown. So there have been some updates to parking structures. We were able to take advantage of the low occupancy across the campus, if you will, to do some upgrades that will hopefully benefit everyone for years to come. We've also changed our parking plans and policies. Some of the rates have changed so that you have more options. We also have a new pickup and drop-off option at Osler parking structure, where we've got several different campus departments participating in basically providing a drop-off service. So you don't have to park your car, you don't have to find a place to park, and most importantly, you don't even have to leave your car, or if you do, you have a place to park, pick up your package, and then leave. So we're hoping to expand that over the next several months to include more of the campus operations. Next slide, please. There have been some ongoing campus improvements that you need to be aware of. And one of the best things to do is to know that we've really worked hard at increasing our pedestrian and micromobility so that the campus is transforming into more of a pedestrian, bicycle, skateboard friendly campus versus an automobile centric campus. What's also extremely encouraging, particularly for some of us old timers, the light rail transit is scheduled to start in November of this year. And that's been a long journey of construction as well as negotiation, but that's going to have a tremendous impact on how people arrive on the campus. And most importantly, it'll give folks from other parts of the San Diego region greater access. Voight overcrossing remains closed, though we have opened up the road in front of the Preuss School because of the light rail construction. And we're happy that a lot of the construction that we were embarking upon was able to be expedited, again, because of the lower numbers of folks on the campus. Next slide, please. I'll turn it over to Michael Korn
Yes.
and Vince Keller.
Thank you, Gary. So for our final update before we move into our Q&A portion, as Gary mentioned, I'd like to welcome Vince Kellen and Michael Korn from ITS, and they're going to speak to us about cybersecurity.
Thank you, Hallie. I really appreciate everyone making the time to come and get an update on this. I know many of you have been receiving alerts from Experian, but let me give a quick overview for those of you that haven't heard about this yet. Earlier this year, the Office of the President had a critical secure file service compromised. Some of you may use it. It's safe.ucop.edu. If you do use it to transfer sensitive data to OP, I would appreciate you dropping me a note. We are contributing to the investigation at OP and trying to make sure we understand the extent of the data exposed. However, that is still under analysis. The Office of the President believes it'll probably be as much as 30 to 60 days before they have a final tally of that. They are at the Office of the President managing the incident. So they are taking responsibility for communicating to all of the impacted users. What they will be doing once they finally tally up whose data was exposed or lost is they will be directly connecting or contacting everyone via email. I don't know if they'll do that by US mail or not. And when they do that, they will be providing impacted users with another code to sign up for the Experian data protection or credit monitoring service. At that point in time, they will disable the general access that they're providing now. So what I really, really recommend you do, and this is the most important thing you can do, is sign up for that year of free credit monitoring services now. Sign up your entire family, alumni, children, beneficiaries, and set a fraud alert on your credit accounts. Consider setting a credit freeze if you can do that. We have links to all of this information up on cybersecurity.ucsb.edu. Go to the next slide, please. OP has updated the information. Again, they've got this microsite, data security/index. You can find it on the cybersecurity.ucsd.edu link. What they've really done recently, aside from expanding the FAQ, is they've added translations into Chinese and Spanish, as well as English, and put it on that same site. Go ahead to the next slide, please. So I wanted to answer a few questions that we couldn't answer well at the previous town hall. First of all, for international students or students without a social security number, they are in the process of signing an agreement for a service, I believe it's Experian Global, that will allow those students to also, and that includes undocumented students, I should add, to also benefit from credit monitoring. But that's a population that lacks a social security number. They expect that to be announced sometime in the next 2 weeks. So again, check their site or check our site, which will take you there, and you'll find information on that. I've received a fair number of emails from people that have had trouble setting a fraud alert on Experian. Let me say quickly, a fraud alert requires anyone checking your credit, say to open an account, to go through a higher level of identity proofing of the person they're opening the account for. It's free. You don't have to do it through Experian. In fact, what I found is the Experian fraud alert site can be a little tricky to navigate. You can set a fraud alert on any of the 3 major credit bureaus. There's the links there. We'll provide those up on our website as well. And once you set it with one, it'll propagate to any of the other sites. Now, the critical thing I want to talk about is many of you are now starting to get alerts that your social security number was found on the dark web. I received 3 of these myself this morning. And we just have to acknowledge it's pretty creepy when you get this. It's a little scary. Remember, these alerts do not indicate that you are a victim of identity theft. They're telling you that your social security number has been found on the web. And in most cases, the alert will say it was released in association with the University of California data breach. Don't panic. If you would like to speak to somebody about it, when you read that alert, you'll notice there's a contact us link right in the alert. You click it, it'll provide you with a phone number. I'd encourage you, if you're uncomfortable with the information or worried about what it means, to go ahead and give it a call. Someone from Experian will pick up the phone and talk you through what that really means. There's also a very nice publication by the Social Security Administration. Here's the link right here. Again, we have that online, that provides a real effective guidance on what you should do if you find your Social Security number is on the dark web. They do not recommend you race out and say, try to change your SSN or change your bank accounts immediately. So that's another resource for you. We were also asked whether or not alumni should use the Experian credit monitoring service. Absolutely. And let me just underscore that I was told yesterday that across the entire UC system, only 93,000 people had signed up for the Experian service. Now, I know in a case like this, it may feel like weak solace that you're signing up for a service like that when your data may have been lost. But it is empowering and effective to sign up for this service, add a fraud alert to your accounts, or if you're not in the middle of, say, hunting for a car or an apartment, go ahead and do a credit freeze. It is an effective way to protect you from identity theft. Lastly, if you have any other questions, I think we have some time. We're going to take questions. And you can always forward any questions or suggestions you have to communications@ucop.edu, where they are being vetted. In fact, I think they updated their FAQ based on what we provided them last time. And I think that's my last slide.
Great. Thank you so much, Michael. And as you noted, we'll take some more questions about this topic in our next portion. So for the next 30 minutes until about 3:15, we'll be moving into taking some of the questions that you've submitted both before the event and during. So I'd like to welcome all the panelists to join me on screen here, and we'll start taking questions. One thing before we jump into our questions that I wanted to note is you're going to see a link in the chat in just one moment. As Nancy mentioned, our campus faculty and staff assistance program will be hosting a space tomorrow, Wednesday, from 2:30 to 3:30 if you want to talk or just be in community or process the verdict today. And so that link is in the chat. It is a live Zoom link, so if you click that one, you'll leave this one, I think. So add it to your calendar tomorrow from 2:30 to 3:30. So with that, let's get started with a question. And let me look at our questions that we've received. Let's see. So Gary, I'll send this question to you. Will PPE be provided once we go back to campus?
A PPE will be provided at low levels in terms of masks, and keep in mind that there's quite a bit of variety in PPE. So we've got fire-resistant coats, glasses. Those things will be provided by the departments as they had been before the pandemic. And the EOC has secured, as well as procurement, masks for the return to campus. So I'm not sure how long they will be provided, but initially, yes, they will be provided.
Great, thank you. All right, so this next question, I think I'm going to send over to either Chris or Angela. For those of us with kids who will not be eligible for vaccines, what precautions should we take in them seeing vaccinated people and possibly other kids who are not vaccinated? And this person says, you can imagine grandparents are anxious trying to figure out how to see their grandkids.
Well, Chris is the pediatrician, but I'll give a stab and then he can follow up. I think, it's a tough situation. I think one, you have to have as much as you can masking. So for your older children, if you can have them masked and limit the number of children they're around, you're going to be in better situation. I think for the grandparents question, if their grandparents are fully vaccinated, CDC does allow them to spend time with low-risk children. So one, you have to know your own child who may or may not have other health risks. So take into account your child's health status, talk to your pediatrician, because it could vary for your child let's say they have significant asthma, then code for them might be a bigger problem than for a child without those issues. So I think we are going to have to be mindful. I don't think we're going to be able to have the kids be as exposed to other children like fully vaccinated adults. They're just going to be in a different space. So I think it's minimize the number of children, enforce the masking, and then know who in your community is vaccinated, such as your grandparents. That's going to be a lot safer. Chris, how do you want to add anything more to that?
No, I think you nailed it, Angela.
It's tough window we're in, you know.
Yeah, and Angela, while I've got your attention, I think another question that has come in is similar, which Chris touched on, but I think it's worth kind of reiterating because it is something we're seeing from staff. So how will we handle staff being back on campus when not everyone will be vaccinated? So I know masking, so maybe speak to that briefly. And then Nancy, I'd love for you to speak to, will vaccines be mandated? What is this looking like kind of from that perspective? So medical, maybe kind of then the employment perspective.
At this point, the masking is incredibly effective. And so we're going to have everybody continue to mask. When we're outside, eating will, for now, remain as an outside situation on campus with distancing, because people have to grab meals, they have to have breaks, and realize that actually being a small break room with 4 or 5 folks is unfortunately one of the worst things you can do. So please continue to have your breaks outside with distance. That is a safety measure. And then we're going to need to stay masked. As things evolve, will we ever get to a point in which we can drop masks? We're all optimistic about that, but we don't see it happening for quite a while. It's going to take some time. And these variants continue to make the picture a little bit iffy, and that's real. That's one of the reasons why we want to stop the spread. The longer and the more this virus can replicate, even if people don't end up in the hospital, even if people aren't dying as much, the virus is replicating, allows it to make mutations that allow it to be more transmissible and potentially less effective for the therapies we have for individuals who do become infected. So we really don't want this virus to have much of a chance to take hold.
And then to speak to the part of the question that you asked me, Hallie, was I think, do we anticipate that vaccines will be mandated for employees, for faculty and staff? So that is a great question. Right now, it is not mandatory for employees to get vaccinated. It is highly encouraged, and just to kind of amplify what Gary said and what we've heard from Chris and Angela and our other medical experts, we're so fortunate to really have this deep expertise and understanding about how incredibly effective the vaccines are, and really how, despite a few hiccups with availability, we're incredibly fortunate to be in a place where, we can get these vaccines, and that's not true everywhere in this country. And so we are really, I think, anything I can say to urge and encourage each of you who hasn't yet gotten the vaccine to please do that. Right now, though, it is not a requirement, and in order to, shift into a potential of having that be mandated, that would be something that the Office of the President, system-wide, would need to determine. I do know that there's a strong interest in getting the vaccine out as broadly as possible, and a really strong recognition from a perspective of science and public health of how incredibly important this is. So for now, we're going with a, strongly encourage and support, and support in any ways that we can. If there are ways that we in human resources can support getting a vaccine or questions, we are happy to do what we can to provide that assistance. And if that information changes, of course, that would be a very important update that we would share right away with everybody.
Great. Thank you, Nancy. A few more questions on vaccines, and I'm going to send over to Chris just because we're seeing some come up in the chat, and we just wanted to make sure to cover these questions. So a few topics related to vaccines. What can you tell us about how long the vaccine lasts? What can you tell us about booster shots? And what are you hearing as a doctor about vaccine verification? What's the latest on that topic?
Good, thanks, Hallie. So the first question is, how long do the vaccines last? We actually don't really know the answer to that yet, because the vaccines have only been administered for a short period of time. They are still following some of the original clinical trial research participants, And there's very encouraging news about strong antibodies still being present. But as Dr. Sosha mentioned, this virus is continuing to mutate. So there are some that are suggesting that we may need annual booster shots the way that we do with influenza. We don't really know the answer to that yet, though. It might be that this is more like a tetanus booster shot, something that you get every 5 years. Or if we get really lucky, we won't need boosters. I think that that's less likely, though. Hallie, your second question, remind me.
Let me remind myself as well. My second question was, let's see, so we talked about boosters, how long it's effective, and then verification.
Yeah. So on the verification question, this is a hot topic. We are working hard with Vince's team, first of all, to modify the daily symptom screening tool, which today for students shows compliance with the lab testing. And we hope by early next week, if you've been vaccinated by UC San Diego Health, that will still show as green, even if you haven't tested because you're fully vaccinated. And so we're working on those changes actively today. In addition, we know some of our students may be receiving vaccine outside of UC San Diego Health. We're already getting a feed from across the state, and we hope to get the feed soon from San Diego County so that we can also turn that green if you've been fully vaccinated, anywhere else, or perhaps you received one dose from UC San Diego and one dose elsewhere, and we'll be able to accommodate that. And then finally, as the state reopens with these rules around live, stadium events, venues, travel, and other things, having separate capacity sections for fully vaccinated individuals, we are partnered with a standard-based organization to make a vaccine verification available if that becomes a standard. So we're not endorsing it. We're not suggesting that it's the right or wrong thing to do. But if it is required, we want anybody that we've vaccinated at UC San Diego Health, including our students, employees, and all of our patients, to be able to digitally certify using an open standard that doesn't require a single technology or single company.
Very cool. Thanks for the updates, Chris. So a few questions about cybersecurity. So Mike or Vince, these will come your way related to the services that people can sign up for. So do we need to sign up with all 3 credit report companies? And can students currently sign up for a free year of Experian? And if they can, is it the same link that staff use?
I'll answer that in reverse. Absolutely, students can and should be signing up. And as I emphasized before, we're clearly not penetrating to everyone on this topic. We need to. As to whether you need to sign up for all 3 of them, if you happen to have one already and it's a different one than Experian, there's no harm in adding the Experian one. It's possible they're all the same on the back end. They all might be outsourcing some of this work, but the extra coverage is only beneficial. When it comes to a fraud alert, again, if you place a fraud alert, it will automatically propagate to the other credit bureaus. So I guess the short answer to your question is there's no reason to run around and sign up for credit monitoring with multiple companies. Use the one that's coming to you.
Cool. And if students want to sign up for that, the same links that we're getting as employees?
Yep. It's the same thing.
Great. Very cool. So Gary, next question's for you. Childcare is a hot topic. So this person wants to know, when will the UC San Diego preschool, ECEC, and MCDC increase capacity?
We're projecting an increase in capacity over the next several weeks based on the tier that the county moved to. We should increase to about 75%. We're optimistic that we'll be able to increase once again by the fall to get back to 100%. And because of some modifications that we made, once we reach 100%, we will have an additional 20 spaces that we did not have before. So we're on a positive trajectory with childcare.
Very good. Moving in the right direction. Great. Terry, this question is for you. In the past, telecommute options have varied based on department supervisor, regardless of position. Will UC San Diego try to standardize this?
I don't know if standardize is the best word when we're thinking about flexibility. So the telecommute options or hybrid work options or in-person work options that a person has will be dependent on their role within the organization, which is often tied to their title code. But as many of you know, There are some title codes that have broad ranging actual work that they do. And so that will dictate whether or not the work can be done in person versus remote or hybrid. So what we intend to do in our meetings is to really drill down specifically into the department's needs, because that's the first thing that we have to assess. What are the department's needs? And for all of you managers and supervisors out there, understand that we know the difference between needs and wants, right? And so we will be looking at needs and how those needs can be met organizationally and operationally. The other thing that we will be keeping in mind is there are public health mandates still in place that require people to be masked when they're going to be at the workplace. And so when we're setting our phase one operational plans, if you will, for folks between now and for them to have readiness in September, people need to think about, the efficacy of someone sitting in an office with their mask on all day, if they're often on the telephone, or if they need to actually engage with other personnel, because that may not be the most effective option for what the organization needs. And so we will have those discussions with folks. We don't expect them to think about it all. We're there to help them think through the flexibility while they think through their operations, and we come together and come up with the best options that will be available for folks. So it won't be standardized, but it will be very thoughtful, and people will have some transparency around, well, if I didn't, why could so-and-so? Well, we will be able to point to objective reasoning about how that was assessed and determined.
Very good. Thank you, Terry. So a little bit earlier, Angela mentioned, she was talking about kind of these best practices for being in a workplace when some folks are vaccinated, some folks aren't vaccinated. So this question, I think probably either Gary or Terry, what will protocols be to drink water, eat snacks, et cetera, when back in the workplace? So what are the rules around these things?
Let me take that quickly, at least what I can answer. At this juncture, if you're eating, you need to eat in small groups, just as folks are doing now. And you should have your mask on at all times, unless you're in a private office. And if you're approached in your private office, you should put your mask on. So the rules at this point for masking have not changed, other than there was an earlier comment about groups of up to 10 meeting. That is the most up-to-date change. Everything else is what it's been for the last several months. And we expect that throughout the summer. It really depends on CDC guidance and how quickly we can get folks vaccinated.
And for those meetings, there is no food or drink allowed, food or drink. So people are to remain masked. And to Gary's comment about small groups eating out, please eat outside. It is a much safer situation than eating, as I mentioned, in a small space inside. That is risky when we have that happen. And we're not at the point where everyone is going to talk about their vaccination status. And some folks may be uncomfortable saying that they've chosen not to vaccinate. So you don't want pressure on your colleagues who may either have a medical or personal reason for not being vaccinated at this time, and they'll feel very uncomfortable. So the safest is follow the rules, eat outside, stay the distancing. That's where you take your break. Unless you're in your own office by yourself, then you can have your cup of coffee or sip of water, but not with others around.
Thank you, Angela. Great answer. All right. So Nancy, last week, campus staff got an invitation to participate in a survey. They got a reminder this week. So here's a question related to that. How will the new Staff at Work survey results be considered in planning for return to campus?
That is a really great question. I'm glad to answer that. So we have two things, both the Idea Wave and the Staff at Work survey, looking at the future reimagined workplace, lessons learned from the pandemic. I would encourage everyone to participate in both of those. They're both vehicles to share your voice and share your experience. And really, it's very important and impactful to hear from staff. And I would encourage, really take the time to share if you have an interest in greater flexibility, if you've seen that you are highly effective, if you are managing people highly effectively using technology, share your experiences. If you have concerns about working remotely, or you have felt a lack of connection or concern about how to onboard a new colleague whom you may have never met in person, share that with us too. We really want to hear just what the experience has been, because it will matter in the institutional, approach that is followed. So because this really is about how do we at UC San Diego, how do we attract and retain talent? How are we the employer of choice? How are we modeling innovation, equity, flexibility for our employees? This matters to every person who's an employee at our institution and every person who's in the future going to become employed by us, because this will actually change the climate and culture and experience of the staff who work here. And I believe for the better in profound ways. And I think this is really a critical juncture for us to think thoughtfully and carefully. And as we've said, not in a rushed way, but in a really strategic way about what can we learn from this past 13 months that we've had using technology in totally different ways. What are peer institutions doing? That's also part of our review. What are best practices in industry? There is a vast literature being developed about these topics. They're very top of mind really for all employers, not just in higher ed, but throughout industry. And so, make your voice heard and share your experience. It's the OSI does such a wonderful job of running the Staff at Work survey process. And it's a very, very sort of sophisticated methodology that is used to really extract trends and information and build upon answers and commonalities in what we hear about. So we look at it very, very carefully, and it really, really makes a big, big difference. And the idea wave as well is a way to kind of build on and generate excitement about ideas related to what could be some flexible options in our reimagined workplace. So I think it matters a lot. Please do it. Know that your information is, very protected as well. The survey methodology is very thoughtful in that regard, and we're very careful about the integrity of protecting, information shared by the individuals who submit their answers. So every reason to do it, no reason to not do it. Please do it.
A good summation. I like that, Nancy. Also note that my colleague Josh put the link to the Idea Wave campaign in the chat as well. So that's something that you can also, as Nancy mentioned, share your feedback. So here's another question that I think could go to Terry or Gary, and we've touched on elements of it. So what else can you tell us about what we should expect to be different when we're back on campus? So we've talked about what meetings are going to look like, how eating and drinking might change a little bit. Are there other things? Will people navigate buildings differently? So what else is going to be different?
There's a lot of construction going on for those of you that haven't been on the campus. I mentioned that earlier. So there's certain walkways that have disappeared. Some have been added. We've put out information. So there's some really good maps that are online that will help people navigate. But the campus will look different, particularly the core of the campus. And the core is near the chancellor's office. They haven't taken those shacks down yet because we still reside in them, but sooner than later they will come down for something called the Triton Pavilion. The light rail, as I mentioned, will start service in November. There's an amphitheater, there's design innovation. So there are 3 to 4 major buildings that have been under construction. 1 or 2 will open this fall, and then there's going to be continued work in front of the current design innovation and the trolley for an exciting amphitheater that's being developed for events and concerts and activities when we can go back to them. So that's just an inkling of what's happening.
It's a great time for a new outdoor event space, isn't it?
Yes.
The only thing that I would want to add to that, Hallie, is something that I want people to keep in mind, especially those people who've been fully remote, is one of the biggest things that will be different when they return to campus is that other people will be there, like in their whole human form and not just within a square, because that will be an adjustment for some folks, and some folks pretty significantly. Like if they've not been out to the grocery stores, if they haven't been going to the malls, if they haven't been going to restaurants, these entire human beings will create potentially some anxiety that they'll have to be able to adjust to. And so we're keeping things like that in mind as well in the planning, because those will matter on whether or not someone can focus on their work because they're wondering if that's really a 6-foot distance from their colleague, whether or not they can focus on their work because they haven't been in their workspace in so long and they just don't remember what that's like, right? And so there's some adjusting that everyone will have to do in one way, shape, or form, including me. So we are keeping that in mind as we are having these planning discussions and thinking about bringing people back. And then to the extent that people are in hybrid work arrangements, we don't want everyone to be in the office on the exact same day. The idea is to have some staggered schedules for those who are hybrid, because what we don't want is the battle over Park-mageddon to begin again, right? Like, we want people to be able to find parking spaces and all those things as well. So just thinking about my colleague Josh in the background there, making sure that we think through all those things as we do the planning.
It's a good reminder, Terry. Appreciate that. All right, so Angela, here's a question for you. What factors will determine if there needs to be a shift back to fewer people on campus? So what are those kind of health indicators that we're looking for?
I think probably before we would have to de-densify again, we look at some more behaviors. We might say, hey, sorry, the meetings can't be as many folks. We're going to put a pause on that. Or TENS company we're going to pull back. It would be a very dramatic change for us to go back to de-densifying. I think we have reason to believe we're going to be able to repopulate. I think Terry's comments about this is going to feel odd. We have lived this way for a year. It is a really long time. Many of you, I hope, are fully vaccinated, and those who aren't, please get vaccinated. But you see, and I'm like that too, even a hesitancy among the fully vaccinated folks, and this vaccine is a really good vaccine, to just return and jump right back in. I think people are slowly meeting with their friends, small groups. They're not running out and saying everything's wonderful. It's going to take a while to adjust to this, and not everybody will move at the same pace. So we're going to have to be really kind with each other and understanding as we go through returning to, quote, a different, normal world. It will feel a little different, I suspect, and there'll be some good from it. There's some good that's going to come out.
Thank you, Angela. So it's 3:13, or 3:12 for our very last question. This is related to cybersecurity. So this would be a Vince or a Mike question. And this person wants to know, do you recommend an alert or a freeze?
I have an alert set on my account, so I would definitely start there. The challenge with a freeze is that if you do want someone to access your credit, again, if you're, say, buying a car or renting an apartment, you have to unfreeze it. So if you are not going through any process that is going to require your credit report, a freeze is more effective. It's a hard stop. But for most people, an alert is sufficient. So that's my general advice on that.
All right. Thank you very much.
Sure.
So that'll be it for us for this month. So thank you everyone for joining us today and for your great questions. And of course, thank you to our panelists for sharing your expertise with us. The questions, so we'll go through the questions, kind of, again, put those top questions on the Return to Learn site. I also want to encourage you to fill out the survey that you'll get after this event. It helps us understand how we can best share information with you. So really appreciate your feedback there. And with that, we'll just wrap things up. So please enjoy the rest of your day.